Hello everyone to MT Podcast. Today I'm super excited to have Dr. Baris with us, a plastic surgeon in Istanbul. Today we're going to dive into the world of plastic surgery. We're going to talk about the procedure and the recovery and all those stages with Dr. Baris. Dr. Baris, thank you for joining me today.
Thank you for inviting me here. It's nice to see you here.
Thank you. It's a pleasure. Can you tell us about your background and what pushed you to be a plastic surgeon? What drove you to this sector?
Well, in high school, I had to choose some profession after I finished high school to go to the college and university. I was in between becoming an engineer and a medical student. And my father sort of convinced me to pursue this career in medical school. I started medical school in 2003. And after that, when I was studying, I knew the first day I wanted to become a surgeon. But I couldn't choose which surgery specialty should I choose.
But you felt that you want to be surgeon at that stage.
Yes, because I wanted to be able to do all kinds of invasive treatments. I didn't want to have any restrictions. You know, for example, if you are an internal medicine doctor, you cannot do any operations. But if you are a surgeon, you can always write some medicine. So that was my aim. I wanted to be able to do everything. Anyway, later I decided to become a neurosurgeon first.
Neurosurgeon?
I wanted to fix people with paraplegia, you know, when they have neurological damage and they cannot walk or they cannot move their hands. And when I was at the fifth year, when I had a plastic surgery internship, I learned that it was actually plastic surgery who is doing the nerve microsurgery and reconstruction of the arm nerves, hand nerves, and most of the nerves. And neurosurgery is doing more trauma and oncologic surgeries. So I changed my aim and I decided to become a plastic surgery. Especially I wanted to do neurosurgery to fix the nerves and vessels as well. So that is how I chose this specialty. Before going to plastic surgery, I also worked in general surgery, by the way. I first entered, there is a prestigious university in Ankara called Hacettepe University. I started to general surgery training in that hospital. I also saw intra-abdominal surgery as well, you know, intestinal surgery, liver surgery, kidney surgery, all kinds of trauma, oncologic surgery. After working there for around 5-6 months, I decided that I didn't want to do general surgery and I had to do plastic surgery.
So you went through a couple of steps before you end up with the main expertise that you are in.
Plastic surgery has very high points. To enter plastic surgery, you have to be very successful in the examinations and in your studies. First, before starting plastic surgery, I worked in emergency department, I worked in ambulance, I worked in general surgery, I worked in public health, in a lot of departments for 3 years. I even did military service for 1 year. After that, I entered plastic surgery. And then when I entered plastic surgery, I was very determined. Of course, there are a lot of obstacles and hardships when you do this.
Sure.
You have to, you know, night shifts are a lot of pressure,
a lot of effort, dedication,
a lot of effort. And then I was very determined, so none of these stopped me from becoming a plastic surgeon. So after studying for 5 years in plastic surgery department, I got my specialty degree. I worked another 3-4 years in the government hospitals. I went to a private university to become a professor. I worked there for 1 year and then I decided that I wanted to open my own office and I wanted to have my own patients, and then I went ahead and working in my private office.
That's great. That's interesting, Doctor. Doctor, a lot of people, they talk about plastic surgery. I'm sure not everybody is having correct knowledge or information about it. There is a lot of myth and misconceptions about plastic surgery. A couple of myths that they are not true and people, they are talking a lot about it.
Yes, the first myth is when you do plastic surgery, people think that we insert plastics inside people to do plastic surgery.
So that's not true.
That's not true. We don't use plastics. We sometimes use silicones, but in most of the surgeries, we don't use any plastics. So plastic comes from a Greek word called plastikos. It means to mold, to shape something. So plastic surgery is about changing the shape or appearance of a part of the body. So, and also it is not the only, this is just one area of this specialty. It is plastic, reconstructive and aesthetic surgery. So we change the shape, we reconstruct, and also we try to give an aesthetic appearance to the tissues that we work on. These tissues are usually the tissues we can see from the external surface of the body. That is why this department is more popular in the modern culture compared to the other departments. So you don't, when somebody has a liver surgery, nobody can gossip about you know how small that liver became or how big that liver became. But when you have a breast operation, they can see and they can comment about it. So that makes it very popular. But as I said, we don't use plastics.
Yeah, I'm sure a lot of people they will be surprised by this. Is not the meaning by the name itself. Doctor, allow me to ask you another question. What are the most common plastic surgery you perform?
The most common operations we perform are rhinoplasty to change the shape of the nose, blepharoplasty to remove the excess skin collecting at the upper part of the eyes, breast operation, reduction of the breast for usually mid-aged ladies, and for younger girls usually breast augmentation to increase the size of the breast. We perform a lot of liposuction. Liposuction is a procedure to remove the fatty tissue under the skin, usually in the belly region, and sometimes we use this fat to increase the size of the gluteal area or the buttocks. This is called BBL, Brazilian butt lift operation. And we also do tightening procedures. For example, if somebody loses significant weight, their tissues start sagging. If their arm skin is saggy, we do arm lift. If their belly skin is saggy, we do abdominoplasty or belly tummy tuck surgery to tighten that area. We do the same for the legs or thighs.
Most of the body part.
Most of the body parts. We also do lifting for the breast as well. So these are the most popular procedures we perform, but they are of course not all of them. We have a very broad range of surgeries.
You mentioned something about the middle age. How can we know, or who's the candidate to this kind of operation? If someone, for example, he wants to check if he's suitable for this kind of operation or not. What we can expect from Dr. Baris in consultation?
Well, before deciding on any plastic surgeries, usually the patients, they have to have a specific complaint. For example, when in my body I might find a place, an organ not so much pleasing. I may say my hair is lost, or my nose shape is not good, or ear shape is not good. But it is the person's own point of view that's important, not other people's. Sometimes I see patients who say, what do you see wrong with me? What do you want to do as a plastic surgeon? In those consultations, I usually try not to answer the patient, because it should be the patient who has specific complaint, so we can work on it to fix it.
So, doctor, you prefer this decision to come from the person itself or the patient itself?
Yes, the patient should have a specific complaint. If the patient doesn't have a specific complaint, if all the complaints are non-specific, or if he or she is relying on other patients' opinions about what is wrong, then we don't do that surgery, because if the patient doesn't know what is wrong, which area is not pleasing to him or her, then it is almost impossible to make that person happy. So the patient should know which organ or which part she wants to get fixed, or he wants to get fixed. For example, if the patient says, I want to have my nose fixed, that's a perfect patient. We know what the problem is. He doesn't like his nose. He wants to get a better nose. The second question is, what does he want to achieve? After he has a nose surgery, there are millions of photographs in the internet now. In the old days, they have to see a neighbor or a friend.
Do the patient come to you and they show you a picture like,
yes,
doctor,
yes.
I want the same shape or the same?
Yes, they show me a picture, but of course it's not going to be the exactly same shape, but it gives us an idea about what his or her expectation is. For example, for nose surgery, how much the hump is going to be reduced. Is it going to be flat? Is it going to be down curve? Is going to be a little bit of hump left there, or what about the tip? Is it going to be elevated, flat, or is going to leave a little bit down curve? So we know what the patient wants from those photos. Of course, everybody's skin type is different, everybody's cartilage thickness is different, but we can get an idea about what the patient wants, and then we can start talking about how much close we can get to those aims. If we can get a very similar nose or not, and how we are going to achieve this goal.
Yes, doctor, is there any, regarding the procedure of recovery, does the patient have any kind of precautions or lifestyle after he's doing plastic surgery?
Yes, we talked about the myths about plastic surgery. Another myth about plastic surgery is people expect after plastic surgery, the next day when they wake up, like that, they want to be fully recovered. Like Photoshop, you have a before photo and then you do Photoshop. In the next photo, everything is perfect. Unfortunately, this is not real. This is not possible. When you have a surgery, you have some side effects from the surgery. You have bruises, you have edema, you have sometimes water collection under the skin. So it takes some time for the tissues to heal and settle down. Incisions, the stitches, they take some time to heal and turn to a lighter color and fade away. For example, when you have a operation in the face region, the bruises usually go away in around 7-10 days time.
Okay. So after
the operation, for example, if you had the eyelid operation, this eyelid operation will cause some bruising around the eyelids, and these bruises will go in 7 to 10 days. You will not have a perfect eyelid one day after the operation. You will have a swollen eyelid which will have bruises, and these bruises will go away in 7-10 days. The edema, the swellings will go away in 4-5 weeks time. The scar will fade away in 6 months to 1 year time, and it may be even longer if the patient has other diseases or other factors such.
Depends on his condition.
Yes, if the patient is smoking, has a sedentary lifestyle, doesn't do any sports, doesn't eat healthy diet.
So all these points are in consideration, and it depends from different individuals for the recovery.
Yes, these will elongate the healing process. It's going to take longer time for the scar to heal. Therefore, the scar will be worse than healthy individuals. The swellings will take longer time to heal. The bruises will take longer time to go away. In some cases, they can leave pigmentation if the healing time, if the patient is smoking excessively, it may take a long time, and this may cause some pigmentation changes. So, of course, in most surgeries, as plastic surgeons, when we consult to each other about a patient, we want to see their 1 year result, because that is, even though it's not 100% healed result, it gives us almost 95% of the final result after 1 year. Yes.
So, doctor, I'm sure a lot of people or patients, when they want to do these kind of operations, they hesitate somehow. So, if you can explain about the benefit and the risk of it, of plastic surgeries.
Yes, when you do something in life, not just surgery, anything, there is always some benefits, there is always some downsides, there is always some risks involved. I usually, when I talk with our patients, most of our patients come from other cities or other countries with airplane. So I talk about an airplane flight. When you fly with an airplane, good thing is that you arrive to your destination very quickly.
100%.
Yes, normally it took 6 months. Hundreds of years ago, it took 6 months to go to America. Now you can come from America in 9 hours or 10 hours. Anyway, this is an advantage. Disadvantage is you pay a lot of money, and you become dehydrated inside the airplane going 10 hours, and you cannot get a good sleep maybe. These are disadvantages that can surely happen. And there are risks involved. What are risks? When you are flying for 10 hours, you can get an blood clot in your legs because of sitting so long. The airplane can have an accident. The airplane can have another technical problem and go land to another city instead of the destined city. These are the potential risks. This doesn't happen in all the airplane flights, but rarely it can happen. And then there is disastrous risks, which are very dangerous, like when airplane falls down you can die, but they happen very rarely. The risk is very minimum. So when you take an airplane flight, you consider these risks and you take a ticket, you buy a ticket. Of course, when you fly with an airplane, they don't make you sign a consent form telling you about these risks.
Of course.
Because the general population has an idea about this from the newspaper articles, so they think that you should know the risks, and then when you get on the airplane you accept these risks. And also there is some insurance if these things happen. In medicine, there is no guarantee for anything, because we don't know how much we will live, we don't know when we are going to get sick. These are impossible to know. So there is no guarantee or insurance for everything. There is a limited amount of insurance in the health. So when a patient decides to have plastic surgery, they have to consider what is the benefit of this. For example, what is the benefit of having a better shaped nose in their own life, in their social life, in their economic life? What is the benefit of doing a breast reduction, getting rid of the back pain, more hygiene around the downside of the breast, the inferior side of the breast? And then you should compare these benefits with the downsides. When you have an operation, obviously you will stay in the hospital, you will lose some days of the work, you will have a healing period, you have to do dressing changes until the wound heals, so there is some work there. You will obviously have some pain after the operation, even though you use painkillers. So there are the downsides, and then there is the risk you take. What if the stitches don't heal properly? What if you get an infection? What if something else happens? So you have to consider all of these and then decide if you want to go ahead with this or not. Of course, usually we all see good things, good results. For example, when we look at the movies or Hollywood stars, we see their good surgeries of their good surgical results of their plastic surgeries. We see good breasts, good cheek lines, good noses. We see the good sides. Nobody shows the other side in the television. And also for the airplane commercial, it's the same. When you see an airplane commercial, you see people happy, smiling, flying in the airplane. They don't show you airplane airplane disaster in the commercials. So, but these are, these information. So you have to decide good size and the best size and the risks, and you can do your own research. Now, in the old days, it was difficult to reach the information. Now it's very easy. You can just write it in the search engines, which operation you want, what are the risks, what are the percentage of these risks, because it is very similar among different doctors or different airplane companies. The risks are usually very similar. Maybe it's 1%, maybe it's 2%, but it's never 1% with one company and 60% with other company. Usually they are very similar ranges. So you can read about the risks, you can read about the good stories and the bad stories, and then decide about the operation. Have an idea about the operation. When people know what to expect, usually they are very happy after the operation. For example, if a patient knows how the tummy tuck scar is going to be, after the tummy tuck, when they get rid of those excess skin, when they have their hygiene back, when they can wear that shirt that they couldn't wear for years, when they can wear it and it fits them, they
More
become,
confident.
yeah, they become more confident, they become more happy. But if they don't do any research and then jump into this, and then when they see their scar, they say, oh my god, what is this, why did I do this?
Yeah, doctor, I must say something. I like the way you are letting the patient to be free, not like for example, when you said that I first wait for the patient to tell me what he wants to change or what is his complaint, not me to advise him, like when they're asking what do you see wrong in me. And now also you mentioned something that I really like, and I'm sure so many people they will like it, that do your own research and don't depend 100% on some commercials or a specific advertisement for that. So I'm sure it's a really important point. Thank you so much for being with us in MT Podcast. For any patient or person who's interested for plastic surgery, you can contact Dr. Baris. We will put all the social media and the number below the screen. You can contact us for online consultation. Thank you so much. Wait for the next episode. Doctor, thank you so much.